There are two types of abdominoplasty, total or the partial abdominoplasty, which differs according to the tissue that we take out. If we take out the total tissue between the umbilical area to the pubic region, it's the total abdominoplasty. If we take some partial part of skin away, it's the partial abdominoplasty. Why we do this operation? The patients, especially due to the multiple births or pregnancies or weight loss and weight gaining in short times, can cause skin sagging, especially for the lower abdominal area, and it doesn't be corrected by the liposuction. So you have to take out the excess skin away. By this operation, we can not only take out the excess skin, but sometimes we can correct the deformities of the muscles and we can tighten the muscles as well. In my hands, it usually takes 2 or 3 hours operation under general anesthesia in the hospital. We make a curvilinear incision line in the in the pubic region, going to the sphenoiliac bones, and we elevate the skin from the underlying muscles. If the patient needs to be tighten the muscle, we tighten with the stitches the muscles, create a new hole for the umbilical area, take down the excess skin, cut out the excess skin and stitch it back. At the end of the operation, patient are waking up with a boost in their legs to prevent thromboembolic events, a urine catheter and 2 blood catheters away. At the first 2 days, I ask my patients to stay in the hospital because we will give you some fluids, we will give you antibiotic, we will watch out your blood pressures, all the vital signs. At the end of the first day, we will take out your corset away and show you what's happening inside. There are lots of towels. We will take out the towels. We will show you the incision line. We will teach you how to care about the incision lines, and then we will put the corset again, and we will calculate how much fluid does come from the inside to the catheters and the drains. And sometimes it takes 3 or 4, sometimes 6 or more days to take out the drains away, because it's about the amount of the fluid that it collects, but it doesn't matter, it's for your safety. At the end of the operation, after 6 hours of the operation, I always ask my patients to stand up. At least a small walk inside the room or inside the aisle will be okay for you to prevent thromboembolic events, and I give you promise to take out the urine catheter when you are able to do that. At the first week is a little bit more painful and more uncomfortable for you, but at the end of the first week you will be more comfortable, even though I don't advise you to go back to your work after 2 weeks. You have to care about the incision line for 3 weeks. At the end of the 3 weeks, if everything goes all right, we stop to put antiseptic solution over the incision, and we begin the softening creams, and at the end of the first week we begin a scar fading cream. Why? Because the incision lines will be red and elevated from the skin level for the first 6 months. After the 6 months, the elevation of the incision line will decrease at the same level of the incision and the skin line, but the color change, it will take 12 to 18 months to disappear to color this change of this operation. So you have to be a little bit patient for the final result of the incision line, but all the incision will be under your in your bikini line, so nobody can see it easily. Our patients are asking me to make a liposuction at the same time, doctor. Yes, I do, especially for the low handle areas, for the size of the abdominal area. Most of ladies need liposuction to be treated, because when you pull down the skin and cut out the excess skin, there may be a round appearance at the sides, so you have to make a liposuction at the same time. But don't forget that it's not a small operation. You have to be ready for that operation, especially you have to be ready for your weight before the operation. You have to be healthy for the operation. You have to stop smoking for the operation, at least for 3 weeks of the operation, and I don't advise you, strictly advise you not to smoke after 3 weeks of the operation. And you have to be ready for the recovery time, and it's an operation that you have to not to combine much more operations, but as we said at the beginning, it's a mommy makeover, one of the components of the mommy makeover operation, and most of people are asking me, doctor, can you do it with the breast lifting operation? If your health status is okay, if your blood levels or hemoglobin levels are okay, if the anesthesiology team says okay, of course we can make it together, but not for facelift, but breast implant or breast lifting with the abdominoplasty. Nowadays we are making these combined operations together so much.